My name is Bekan Guddata, and I'm from Ethiopia, and I'm a lecturer at Wallagga University. So my title says the management practice of primary dysmenorrhea among female high school students in Naqamte town, East Wallagga zone, Western Oromia, Ethiopia, which is a cross-sectional study. So this is my title. Then there is a outline. The course outline, no, the outlines for this presentation. So at the beginning, I will start the introduction. Then after introduction, by which the data may collected or by what means the or the materials that I have used for this research. So that is methods and the materials. So I try to highlight the methods and the materials. Then the result is also I try to include the result is and the discussion part is also there. Finally, I can conclude there is a conclusion and implementation recommendation also there. So these are the outlines. Okay, I think primary dysmenorrhea. What I mean primary dysmenorrhea? So it is a recurrent cramp like lower abdominal pain occurring. It may occur before or during menses or menstrual cycle without underlying cause. This is a simple definition of primary dysmenorrhea. We can differentiate this primary dysmenorrhea. At the beginning, there is a dysmenorrhea, which means a pain during menses. So it can be classified as primary or secondary. We differentiate the primary dysmenorrhea from that of secondary dysmenorrhea by this underlying pelvic disease. For example, if the ladies or the women may have the diseases like endometriosis, fibrosis, PID, which is pelvic inflammatory disease, adenomyosis, IUCD, or any other disease, and with these diseases, if they may have this pain during menses, that is not primary dysmenorrhea, that is secondary dysmenorrhea. So primary dysmenorrhea is it is a pain during menses without underlying cause. So this primary dysmenorrhea may last for 8 to 72 hours in average, and sometimes this pain, it is lower abdominal pain that may radiate to back or thigh of the women's or ladies. So this is the definition of simply primary dysmenorrhea. Again, the exact cause of primary dysmenorrhea is not well defined, so it is not clear. That means, but most authors agree this primary dysmenorrhea can be occur when there is increment of prostaglandin during menses. This is the cause that some authors can agree on. Again, it is also well managed. This primary dysmenorrhea can be managed by either pharmacological or non-pharmacological measures. These are the management options that the women may have for this primary dysmenorrhea. Again, this primary dysmenorrhea is the most common problem among adolescent girls worldwide. For example, it may cause the socio-economic challenges since it is a worldwide issues or problems. It can cause socio-economic challenges, especially among adolescents and young women. For example, if you can see the socio-economic challenges, for example, it may affect the relationship between their parents, or if she is married, it can affect the relationship with their husband. Again, it can affect their daily functioning, productivity. Again, if they are since our study area is in school, so it may cause school absenteeism, and also this primary dysmenorrhea may affect academic performance. Again, when we come to our country, in Ethiopia, there is no clear guideline for this managing primary dysmenorrhea, because people may perceive, or the women may perceive this primary dysmenorrhea as symptom that is routinely occur during menstruation, and they think it as a normal phenomenon. So because of this, okay, so there is no clear guideline which can manage for that of primary dysmenorrhea. Again, what is the aim of this study? This study aim assist to students, school authorities, and organizations that are involved in menstrual hygiene practice, and in gaining a deeper understanding of the management practice, specifically for this that of primary dysmenorrhea. So this is generally talks about primary dysmenorrhea, what is it, and the what are the global trends with regard to this primary dysmenorrhea. When we come up with methods and the material for these studies, the study area for this research is a Nekamp town, which is located in western Oromia of Ethiopia. So the study period from November 6 to December 6, 2024. These are the when the data become collected. So it is a school-based cross-sectional study. The sample size that we have used for this research is 422 ladies or female high school students. We have used this sample size, and we calculate the sample since there is no study research on for this with this management practice in our country. We can use 50% because there is no study. Then we calculate by using APA info, and we got 422 by adding 10% net response rate. So by this it can come up with 422. Then we have dependent variable and independent variable. Our dependent variable is the visual analog score to know their level of their pain. Okay, we can use this visual analog score. So we can measure 2 times visual analog score. One, visual analog score after female high school students before they can take any measure. For example, before they took to the students who use pharmacological option. So after they can use pharmacological option, they record their pain score. So the visual analog score contain from 0 to 10 scale, then they mark their scale. So our dependent variable is the visual analog score of female high school students before they taking any measures. Our independent variable is visual analog score of female high school students after they can take measure. For example, if they can use pharmacological, so after they use pharmacological, what are their scale? That is our dependent variable. Sampling technique, we can use multi-stage stratified sampling technique. So we can start from the broad one. So the Nekamp town contain around 11 high schools. When we say high school, which is above 9 grade, okay, that high school. So again, it contain 7 private and 7 public and 4 public high schools. Then we can stratify these, and finally we can get our target population. So that is the sampling technique. Data collection tool, this can be adapted from study conducted in the Lebanese university. So we can simply adapt the data collection tool from Lebanon. Data entry and analysis. So for data entry, we can use Epidata version 3.1 and the SPSS version 25. So we can use these softwares for the analysis. So ethical consideration. So it can be approved by Institutional Review Board of Walaga University. So we got the ethical approval from the Walaga University Institutional Review Board. So when I come up with results, so the study participant, their age ranges from 15 to 22 years with mean of 17.77 and the standard deviation of 1.57 years. So again, the severity of their pain, okay, around 69.3 ranges. They range from moderate to severe pain. So this is the severity pain. Again, they consult when we come up with consultation, which means so the study participants may consult their parents or their friends or healthcare professionals. From these, okay, around 63.8 of the female high school students of Nekamte town do not seek any advice or any counsel. That is the issue. Again, only 20 of the female high school students, which is around 5.3, consulted healthcare professional. So this shows there is a little bit or students can consult healthcare professional, because as I have said, so they can perceive this primary dysmenorrhea as a natural phenomena. Because of this, they don't consult any healthcare professional. Okay, so again, the female high school students, they can opt for non-pharmacological options. Again, this point, or around 79.1 of the female high school students, they can approach it for non-pharmacological options. So this means this point, or 79.1%, shows they can use or non-pharmacological or pharmacological options. Okay, so this is not only. Again, from these non-pharmacological approaches, the most commonly used type of non-pharmacological measure is drinking tea. Around 21.6 of the female high school students can opted for their management for that is drinking tea. Again, for sleeping, again they can become opted for sleeping and the drinking ginger with tea. Around 16.8 female school students can allow the drinking ginger with tea. So again, we can perform a multi-stage linear regression to know the efficacy of these non-pharmacological approaches. From these non-pharmacological approaches, sports and hot base shows significantly reduced pain score with these. For example, if you can take sports, their p-value is less than 0.04. Hot base, which shows the p-value is around 0.026. So the sports and hot base shows significant reduced pain score. Again, when we come up with pharmacological measures, to around 50 or 21.6 of the female students can opt the pharmacological measures for their management option of primary dysmenorrhea. From these, the most frequently practiced or used ones, diclofenac, which shows around 52.1%, followed by ibuprofen, 21.7, and the PCM paracetamol, around 14.6, and finally they can use OCP, that is oral contraceptive pills. Only 3 students can use oral contraceptive pills as a pharmacological management option for their management practice. Again, from these pharmacological measures, 30 students are self-medicated, which means they can simply either bought from the pharmacy or simply without any prescription from healthcare professional, they can use these pharmacological options. Again, we can perform one-way ANOVA that reveals significant difference in pain score after patients received medication. So one way we perform one-way ANOVA to know the efficacy of these medications. So with that of Taki post-hoc analysis that shows or that reveal that ibuprofen with around 13 with M or median, that is 3.34, and the standard deviation 2.2, it shows significant reduced pain score more than that is diclofenac. So this is the result of one-way ANOVA. Again, the paired sample t-test is also, we performed the paired sample t-test that showed or to test the efficacy of the either pharmacological or non-pharmacological efficacy. So both pharmacological and non-pharmacological intervention shows they are efficient to reduce the pain score. Okay, be after they can took the either pharmacological or non-pharmacological. For example, specifically when we come up with the non-pharmacological measures, it lowers pain score from 5.3 mean, that is mean 5.38 plus or minus, that is standard deviation, to 3.1 with that of. So it is significant. Okay, so pharmacological measures that I've listed soon. So significantly it can reduce the pain score. Again, when we come up with non-pharmacological intervention, as per sample t-test shows, so it can be reduced the mean from 6.14 to 2.23. That is significant because the p-value is less than 0.0. So these are the results. Again, when we come up with discussion, in this study, 50.8% of students used some form of pain control. They use, okay? So of this, around 75% use only non-pharmacological method, the only 5.2 used only pharmacological options or treatments.